Well, hello. Good evening and good morning wherever you are in the world. I am Lynn from Cavi Central Guinea Pig Rescue, and I thought I would come on tonight in light of a few piggies that we've had in recent days that, yeah, I think there's a lot of information to share with you around calcium and what we're seeing and some thoughts on that. So let's have a bit of a chat about calcium tonight. Now, before I do that, as you come into the chat, let me know if you can hear me. Okay, I'm hoping the sound is all right. Someone pop up a message. Let me get that chat on the screen. Hello, Carolee. Hi, Suzanne. Hello. Welcome. Can you hear me okay? Let me know if the sound is coming in okay, and we'll continue on. And we've got a bit low. Okay, I have forgotten to get the microphone, which would help, wouldn't it? So what I might do, I'll leave you for a second. I'll go grab it. Okay, hold on. I'll be right back. You can watch the piggies behind me. Okay. I know. Got to feed down the other end. Let's see. Hold on. Should have grabbed this to begin with. Let me see. All right. Let's see if that makes it a bit better. How is that? I'll put that back there. Use that for a minute. How is that? Testing. Is that a bit better, everyone? Oh, you do have a King Kong baby, Suzanne. You absolutely do. You do. We'll probably put her on the next live as well. Yeah, how is the sound for everyone now? Let me know. Better. Bit better. Should be a lot better. Really? Okay, well, I'm afraid that's the best of what we've got. So, yeah. Okay, let's start. So, I wanted to have a chat about calcium, and the reason for that is that there's so many stories and mixed messages that we hear all the time about calcium and calcium diets, what you should do, shouldn't do, that I thought we really should have another chat about this. And particularly in light of some piggies that I've got here to show you. I'll show you them right at the end, and hopefully we can go through a bit of information first. But calcium itself is actually needed in the diet, and you've probably heard this or may not have heard it, but you do need it for bone health, for your skin, in fact, for so many things, in fact, like your metabolism, for your nerves. There's lots of areas in your body that it's absolutely necessary that you have calcium. So for people who are trying to eliminate calcium from diet, it's actually really, really dangerous, because as guinea pigs, they're constant. Whoa, that's the little boys. They want their food. So they constantly need calcium in their diet to help with the growth of regeneration of teeth, for example, that are constantly being worn down, as well as bone health, and everything else. So it's really dangerous to reduce it. So how do you get calcium to begin with? Well, there's two actual ways that you can get calcium, and it's really important that you identify the two different ways they can consume it. The first method is through natural foods, natural food that we give them. So put that down here for a minute. Cucumber as an example, I've just grabbed that. Natural grasses, your hay, all of the natural foods in a guinea pig's diet, they contain a level of calcium. Some levels of calcium is higher in some foods as opposed to others. So we'll come to that a little bit later. But essentially, the natural food sources that you have from grasses, from hays, and from the vegetables that you supply, the way that it's absorbed into their body is slow, because as hindgut fermenters, they're constantly breaking down the food, and it's through that process that it actually gets absorbed relatively slowly into the bloodstream of the guinea pig. So that is quite an essential point, because if you give them other foods that are man-made, for example syrups, or their pelleted food, they're also supplemented with calcium, but the calcium in that is actually absorbed very quickly. And because it's absorbed quickly, it means that you can actually have an excess of it suddenly within the body that it's trying to deal with. So there's a slow way that it sort of continues throughout their day, as opposed to a fast method of getting calcium into their system, which could lead to an excess, if you like, that needs to be excreted later. So with pelleted foods, for example, that changes from brand to brand, and there's different levels of it. It's not to say it's a bad thing, but it is a questionable way of creating excesses within their body. So something to consider there. Okay, so once guinea pigs actually eat their food source, it then, through the process of digestion, gets into their bloodstream, and in their bloodstream is then what then happens depends on a number of different factors. We hope that it gets absorbed and it's used in the right way for their bone health, for their teeth, for their skin, the metabolism. But if there's too much of it in their system, it is then actually going to be excreted from the body. But there's a couple of other things can occur in that process where calcium can actually attach to other nutrients in the body, and that's where we look at stone creation. So, and that's quite dangerous. So stones, these little guys here that you can see, let's get one out. Take a look at them. You've seen us remove them before. They look quite white. When they come out, they're often they can be darker, more yellowy, or we see them as different colors, but when they dry, they are literally calcium, white, solid, and like little tiny rocks that form. And the formation of these is what can be lethal for guinea pigs. And in some cases we can help them, in other cases not. We'll cover that a little bit later. But in terms of excessive vitamin C that can be excreted from a guinea pig, what you will notice tends to be little crystals that form, or little white patches. You might see it on bedding or in other areas. If you're using shavings, it's very hard to detect, but if you do have a cloth bedding, you'll often see little white patches, and that's generally where calcium is being excreted. So it's a little white crystallized sort of substance when it occurs that way. If you pick your piggy up and you have a look at their nether regions, often you'll see white crystallization around that area, and that's another indication that calcium is being excreted. So that's what we need to look for. Some of the things that affect the absorption of calcium into the body are things like vitamin D. Now, vitamin D is something that the body makes when in natural sunlight. So I've always promoted that guinea pigs should at least once a week have some outside time, have some direct sunlight that actually promotes vitamin D within their system, because it naturally helps the absorption of calcium in the right way. So for people who only keep their guinea pigs inside, please consider that, sitting with them outside, nursing them, having some time with them. That's one of the things that can help. Potassium, zinc, magnesium, they also help, and they come in naturally through their diet as well. So all of these nutrients working together, and vitamins, they all work together in different ways within their system. Problems arise when excess calcium is in the blood, because then it can bond with other minerals and form stones. And the stones themselves that we looked at just there are known as calcium oxalate. You'll often hear them being called uroliths, is another thing. When they form in the bladder, they call them uroliths. But essentially they are calcium oxalate, which is a very hard stone-like material. What also forms in the bladder area is commonly known as sludge. And sludge is a little bit like, I guess the name implies, liquidy formation of crystals that haven't yet solidified to a stone, but they're causing problems. So the issues that generally occur with sludge is that they're more prone to bladder infections and so on, and the two come hand in hand. So when you deal with stones, there's generally sludge involved as well. Foods that are high in calcium. Actually, let's have a look at what we look for first in terms of guinea pigs. Oh, actually, maybe not. I've got a few notes here taking you through. Yeah, let's deal with that after. Okay, I've got lots and lots to give you tonight, so I hope you're okay with it. Pop your questions up into the chat area, and then I'll go through them later if you do have them. And if your thoughts, if you have any thoughts to raise on it, definitely, because these are my thoughts and why we've always promoted the sorts of dietary advice that we give. So a few things that actually affect the absorption of calcium are what calcium, the things we've just mentioned, like potassium, zinc, and vitamin D. But other things like phosphorus in the diet can actually also affect calcium, because phosphorus, if there's too much phosphorus in the body, it needs calcium to be absorbed into the body, and the body needs phosphorus. So that's fine. But if there's too much phosphorus, way more than the calcium link, it actually sucks that out of the bones. So it has a reverse effect on the body. So does things like phytic acid is another one, and we have that in people. It's known as an anti-nutrient. Now, typically, we don't get a lot of phytic acid for guinea pigs because it's contained in lentils, peanuts, so we don't have those as part of their diet. But there is elements of phytic acid in their diet, but not excessive amounts really. But both of those things can cause problems with calcium and how it's used effectively. Foods that are high in calcium, we can look at kale and parsley, which are really, really good. They're high and they've got a really good balance of calcium, but also of the phosphorus level, which is always lower. It tends to be lower in natural foods, which is great. But where it can get out of kilter causes problems, and we'll come back to that in a moment. So what I've got is a little drawing, because that's probably really confusing. But let's take a look at this. Can you see it? Let's have a look. Okay, so guinea pigs. When we look at calcium, it comes from two different forms. So we're looking at natural forms, which I think I've got, on this side here. So the foods that are natural to them, hay, grasses, vegetables, plant matter, plant-based matter that you give them, is all a form of calcium into their system, but it is a slow digestive form and absorption through the body. This method over here, through pellets and syrups and other additive foods that we give them, it's in those foods as well, but it's fast. Now when it goes into the guinea pig, it then, through digestion, becomes part of the blood. And in the bloodstream, it's then going to be picked up and put into the bones, or if there's too much phosphorus, as I've just mentioned, calcium can actually be excreted or pulled from the bones, so one way or the other. But essentially, after that process, we're looking at calcium being used. I'm trying to find my fingers because it's opposite on the screen, to go to their teeth and bones, their different nerves, their metabolism, all of those areas. Otherwise, it's going to be excreted from the body. Now, during this process here, in the blood and in digestion, depending on what's being eaten, it will be excreted excessively as calcium or as stones. Or if the stones are too large, they'll be inside the bladder. Sometimes the kidney, but yeah, inside the bladder. So with that, the sorts of things that actually have, actually we've talked about foods that are high in calcium. There are some herbs that are really super, super high, and you may not be aware of them, but sage and oregano, marjoram. If people are giving your guinea pigs lots of these, they're very, very high in calcium, something like 100 times more so than in kale and parsley. Oxalates, there's a lot of talk about those, that if a lot of oxalates are in the diet, that calcium absorption is interfered with. And what we're looking at here is things like spinach, your dark leafy greens, chard, beetroot leaves. They can generally have a lot of oxalates in them. And oxalates, they bind to the calcium so that the body can't absorb it. And in this process, it's not going to be used effectively. So by reducing oxalates in the diet, you can also be helping your piggies. So when we look at natural grasses, and we promote they have as much natural grass in their diet as possible, it's very similar to kale in a way. Kale is wonderful in terms of its nutrients and vitamin levels. It's fantastic. But it's high, while it's high in calcium, it also has a relatively good level of phosphorus in there. But grasses are not dark and leafy, they're much lighter, and for that reason they also have a good balance of vitamin C in them, a natural absorbable form of it. One of the things with creating problems with calcium and stones being formed is also the age of the guinea pig. We typically don't see babies that have any stone issues. So they're very, very young. Their diet is very new to them. They haven't had the lifelong, I guess, health issues of diet. So older piggies typically are where we see stone formation. And as they get to be much older, they tend to be much more prone to it, rather than, so typically age does have a bearing on stones and stone creation, but not all piggies form them. So it's not common that we have every guinea pig forming stones. And in this way, it's interesting to look at families where they're surrendered, where we have siblings, because it may be that one guinea pig has stones and none of the others do, but they've all had the same diet within that lifetime. So there's definitely more to this than just diet alone. There's some predisposition that is not yet hard and fast established, but it definitely exists. So males and females also handle stones differently. So when we look at male guinea pigs and female guinea pigs, their physique is obviously different, but if we look specifically at the bladder releasing into the urethra, where the urine comes away, males actually have a very thin tubing compared to females. So females are more likely to be able to pass any stones where males can't. So we frequently see that if we look at surgery that's required, usually it's a higher ratio for males than it is for females, simply because of that. Some piggies definitely are more prone, and yeah, in that sense, when they are more prone, simply surgically removing the stone or them passing the stone doesn't fix the problem. We typically find it recurs, and often really quickly. So in surgical cases, I've known stones or guinea pigs to reform stones within 3 weeks. So that's a really short time frame. Not as common, but certainly, within months of surgery also can occur. So it's much more common, even with dietary changes. So something to be mindful of if you're considering surgery with removal of a stone. Signs that your piggies have stones. Typically they're in pain, and pain with urination can be seen. So if they're trying to pee, they will squeak and they'll hunch over, and that can be an indication that they have a calcium stone related issue. Often if they have pain in the abdomen, this can also be typical of stones. Piggies that have pain from stones tend to stop drinking. Now, drinking is really important because it helps flush everything through. But what we find is that through the process of pain, they know that if they eat, they pee. It's almost like they naturally know that process, so they stop drinking as much to cut down on the pain level, but it's really necessary. So that's a little thing to watch, as if they've decreased or increased that process of drinking. Discharge on your guinea pig can be, again, those white crystals occurring around their butt area, but also on the bedding. You might see little white spots everywhere. You may also see blood, because bladder infections are really common when guinea pigs have stones, and in part that's due to the sludginess of that. Infection is really easy to take hold either there or in the bladder, so urinary tract infections are very high with piggies with stones. Pain relief is absolutely necessary if they've got stones, and that's one of the things to be mindful of. You can't leave guinea pigs that are peeing and in pain. You need to act on that. It is an emergency as well, because if it blocks that area, they can essentially die from kidney failure very quickly, but the pain level is also so high that something needs to be done. So you've got to seek veterinary help with that right away. There is a risk of the stone actually blocking the bladder if there is a stone in the bladder area. And if it's in the urethra, as we'll see shortly, it can actually block that area. Again, over days it can lead to kidney failure. So it's important that you deal with that. Okay, so the treatment for stones. There's a number of different ways that you can deal with stones. Essentially, surgery is the most common, because the stones usually found within the bladder, and we see that by x-ray. If you've not seen guinea pigs with stones, it's usually by x-ray. They can determine if there's 1 or 2 there. We've known guinea pigs that have stones that are under 1 centimeter in diameter, and they can measure that on the x-ray to be able to pass them if they're female. Now, that's not saying that all females can pass those stones, because obviously the size of the female has a lot to do with the passage of that. But certainly I've known guinea pigs of stone size up to 1 centimeter to be able to pass them. So if you do have an x-ray taken and it is, let's say, 0.5 centimeter, there is the potential that they can pass that stone. Male guinea pigs typically, again, because of how their body is shaped, don't pass at that size. It needs to be much smaller. Stones never reduce in size unless something is can't even say that. There are some medications that we've trialed, and for some guinea pigs they've been successful. For others they've not, and there's problems with that. So there are 2 products that we've tried out there, Lithium and Urologist, who we've used for years and years and years. And Lithium and Urologist actually have a lot of people who will tell you it was really fantastic to use and very helpful. The problem with those products is firstly that they're overseas. We actually get them from Germany. And so in the past, when we've got them, it could take up to 6 weeks to actually get them. So if you've got a guinea pig with a problem right now today and you don't have access to this, of course you don't have the ability to try a product like that. There are other products like Uricol, and there's some Oxbow products as well that can help with that, but it doesn't actually typically reduce the stone size. The most effective method for removing them in the bladder is surgery. If they're in the urethra, they can be removed, and that's a much more hopeful situation if that's the case. We've had an interesting, there's actually a girl that I know contacted us. This is a story going back like 10 years ago. But she was in year 12 at school. She had a guinea pig, and her guinea pig was bleeding, and she didn't know what to do. She contacted us. She had been to see a prominent exotic vet here in Sydney, who said that she needed surgery to have the stone removed. She had the x-ray of the stone, and she came to me because she was in year 12 at school. She couldn't afford the fee, which at that time was like $1,200, but now it's well and truly up to the 2,000-ish. But she couldn't afford it. She didn't know what to do. And we had a chat about it. We had Lycia urologist here, and we started popping her on that. Now, the outcome of that process was that the guinea pig eventually passed the stone, and it was found on the bedding. Now, you could deduct from that the guinea pig may have actually naturally passed the stone eventually. That's a possibility. Or it may have been that the herbs, as they say and direct, did reduce the size of the stone. So we can't hard and fast say which it was. However, the stone was passed and the problem resolved. And she actually went on to become a vet because of what was experienced at that time. But we've also had other guinea pigs on that where, again, not successful, and you have to go down the surgical path. So I hope that sort of gives some insight around products that you can use. They're not they're not an answer, but they may be a solution if you've got the time and the opportunity to try them. The one thing I stress there is the pain management, because if guinea pigs are in pain, you can't have them that way. And of course, she had actually pain management. The vet actually provided that for her, so that was fine. But you know, people often don't have these products at their fingertips where they can try them. The other is the surgical aspect, because it's quite invasive and it's also quite expensive, and a lot of people can't often afford the veterinary care and fee associated with that. So I do have a video that is on euthanasia, and I'd recommend that if you're in that situation that you take a look at that, because it can be a gift of kindness, but you can't leave an animal suffering. You must act. You have to seek veterinary help with it in one way or the other. Okay, the last thing is, if you've got these stones that have passed through the bladder and they're in the urethra, so they're on the way out where urine travels out and they get stuck. So that's the sort of situation that we can help with, and usually we can remove them. And we're going to take a look at some piggies now that actually have some stones. Oh, excuse me. And that's part of the reason I thought I'd come on here, because we've actually had a number of them recently. They are older guinea pigs, so it's ticking all those boxes of being older, and it's sort of in line with what we're seeing. And I just want to show you how to detect them and show, you know, what it looks like, because each of these cases, it wasn't known. They didn't know that the piggies had these, so they were surrendering the guinea pig because their mate or buddy had passed away, and they've been loving and caring owners, but they simply didn't know this existed. So we'll take a look at some of them. Just before I do that, let me have a look at the chat, because I've been all over the place. I'm sorry if it's been all over the place. I'm thinking of a trillion things at the moment. Don't think there's too many questions there. Amazing. Yes, she has a urethral stone, which we'll take care of. She's been drinking a lot. Yeah. She and Francis together have wet towels under them. Good. Good, good, good. If she's drinking, that's a good thing. It's pushing it all through. Thank you, Will. Yeah. Yeah, definitely not. I see it so many times where that's the case. When people just leave them, you can't. You cannot leave them. Let me show you the first piggy. Piggy number 1. Okay. Oop, here she is. This is piggy number 1. And she's a newcomer. She's 7 years of age, this girl. And quite often with guinea pigs that do have stones, we find that they're losing weight. So that's one of the things to look out for. They can lose weight for lots of reasons, but we often find guinea pigs that have a stone are losing weight. And she's a little bit on the thin side, but she's got a lovely glossy coat. She's a bit older. You're a sweetie. Let's have a look at her bottom. So, and this is where, just trying to stay a bit quiet for her. Okay, so this is the bottom. You can see little bottom here. Is that a good view? Well, not really. Hopefully. Let me see that. Okay, so down here, maybe not. Is that working? Maybe. You can see she's got a little bit of hair loss there. That is not to do with this stone, but the stone itself is right here. At the end of the fur, there's a little dip at the abdomen. That's just at the base of the bladder. Base of the bladder. Trying to get it in view for you. And then there's a lump. It literally feels, you can see it under my thumb there, feels like a stone when you're touching on that area. Literally is a stone. I should go that way. That's better. It feels like a stone. So that was missed with her when she came in, and as soon as she came in yesterday, we noticed it. So I'm going to get rid of that stone, and I'll film that so you can watch it. But we've got, thanks Suzanne, she's popped up another video there of a stone removal. Let's see if it's easier to see on this piggy. Hold on. Hello everyone. Hey. Hi. Let me see. Oh, it's a little bit more obvious. Okay, this is a little bit more obvious on this piggy here. It's not easy for me though, is it? So I've got to lean over, and I like to have them. I know, I like to have you here. Hold on, she didn't like that. Let's see. Maybe I'll get my ladder. No, we'll try here. Oh no, I'm sorry, Bubby. I'm sorry. I'll try this. There. I'm sorry. So, this little girl here, she's again dark, isn't she? I can see it really well from this way. Maybe I'm just used to spotting them. But, right where her urethra is, let's have a look. Right here. Whoop. It's not going to work, is it? I know, it's not going to work. It's all right. I've got you. Yeah. But she has exactly the same thing. You probably may not make it out as well there. I'll pop some photos up later on Instagram maybe. But that area there, you can see it's a little bit more naked with hair. It's literally a stone. You can feel it. It feels like a lump, and it's always right there. So when you pick up your piggy, support their back against you, and you can instantly feel the base of the bladder and any stone that presents. It's literally a hard stone. Her stone is much bigger than the other girls. Oh no, I'm sorry, it's an awkward position. Let's have another look. This little lady. Now this little lady here, she's been with us a while and she's an example of recurring stones. So she does make them all the time and we don't feed her lots of foods at all that have salicylates in them. She has a really good diet, but she's one of the piggies, and we're talking about, 100 piggies. She's the only one that repeats stones. Now she's a surrendered piggy. She's not a piggy that's lived long term here, but she's very, very prone to them. But her stone, now she's white, so it's probably easier to see. Let's have a look. Again, just sort of putting her on my shoulder. You'll notice she's a bit more naked down around this area, but the stone is sitting flush right there. That's a decent sized little stone. You must be careful too that as you press on that area, it is the base of the bladder, and they can literally urinate right away. I'll put you down in here. There we go. Let's see. So I'm just about to remove all of those stones. Not so sure how you saw that on the screen. I tried to do my best, but yeah, hopefully. So, have you got any questions or thoughts on stones and stone creation, diets? Because we hear, I see it a lot in the forums. People talk about calcium, they talk about removing it from their diet, cutting down. They do things like you must have 1 leaf of this and 2 pieces of that and this measurement of this and only give so much. And they have these strict regimes of exactly what to do, what not to do. And I completely disagree with it. I think that from a management perspective, it's a little bit overboard. And I tend to look at a more natural foraging diet. I promoted it for forever. These are ground foraging animals, and as much grass as you can give them typically has the right ratios of calcium within the grasses, lower phosphates, and of course it has all of the vitamins and nutrients contained within. So if you've got that sort of a diet, it really does lend itself to being absorbed in the normal way. You're not reducing any calcium that isn't needed, but you're also not giving them any excess. When we talk about giving additive or added items to foods like pellets, piggies do consume additional calcium in their pelleted food. So taking a look at pelleted food, it is a man-made item. Again, I just promote giving as much grass as you can, and then they really don't eat as much on the pelleted food, I find. So trying to keep that as low as you can. They say about a tablespoon a day with pelleted food, but again, different pelleted foods can vary, and they also have a lot of fillers in them, which are not necessarily good. It's not particularly great. Yeah, Timothy grass is great. All your hays actually have a fantastic level of absorbable calcium within them. It's really, really good. It's available to them in dried hays. So across the board, hays are pretty good in that. They also have levels of phosphorus that are also lower, and there's some variance in between them. One of the things that does change a little bit more tends to be the carbohydrate or the fat content. So things like alfalfa hay tend to be higher in that. And when guinea pigs are young, that's why they need added levels of those things until their diet is well and truly established. And typically, young guinea pigs or nursing females, you may give that to. So that helps a little bit. Are females more prone to stones than males? No, I'd say it's actually I'd actually say about the same, but what I would say is that males do result in either euthanasia or surgery, whereas females, much more commonly, we can then remove them. So, and that's a positive thing. We don't get a lot of guinea pigs coming in with stones, but it's interesting, you know, these 3 that have come in that have them. So diet's so important. Yeah, giving your young mum and bubs lots of dandelions, fantastic. Milk thistle's fantastic. Yep, natural grasses. They're foraging animals. They absolutely do really well with it. And also the silica within those is fantastic for teeth and grinding. So really, really good. There's silica in vegetables, but yeah, it's fantastic in natural grasses. Winter they get their pellets, but summer I reduce them. Yeah, I tend to find, Will, that if you're giving them lots of the grasses, they don't have so much of the pelleted food. And when they've been on grass time here, literally, when they're brought back to their cages, that you find them just more relaxed, laying down, not doing as much. So, yeah. Yeah, but natural foraging foods, I think it's you know, a real plus. Kale, you know, it's a fantastic vegetable. It really is, or leaf, it really is. It has so much to offer, but typically now it's become quite expensive and also not as easy to obtain. So if you can grow it, that's fantastic. Really, really good. But again, you know, you might not want that. Now, if you're giving your guinea pigs kale and you're starting to see lots of white discharge, that's because they're eating an excess amount of it. It's not needed within their system, so it means they're getting an adequate amount of vitamin C. So the body is just excreting what isn't needed, and that's fine. Oh, good. Good, Will. That's excellent. Yeah. So trying to do that is good. Getting as many of those natural vitamins. Actually, another thing that grasses offer, and you've probably heard me in other live streams mention it, but it is probiotics, because when we give them vegetables that are from a store, like, you know, Coles, Woolworths, wherever you get them, if they're pre-packaged or in any way just prepared, they put them in a saline wash, and that actually takes a lot of what we have as probiotics off the grass, so, or off the foods. So if you grow the foods yourselves in your own home, on balconies, in backyards, or grasses outside, the probiotic level is actually really high. So that's another reason to give them natural foraging foods, because it really does help their gut health overall, much more so than store-bought foods. It's a really fascinating area. There's so many different things that come together within the body, and an over amount or an excessive amount of something can kick another area into trouble. So, you know, we've talked about vitamins not being there, like the need for outside time vitamin D. Lots of people will keep their guinea pigs inside, and they've been inside for a lifetime, and they'll say they've been fine. But again, you know, they may be having more grasses brought to them, or they may be having more hay, lots and lots of hay, so they've got lots of available calcium in their diet, which combats that, which, you know, you have to look at all aspects. Yeah, well, pellets are actually very effective for weight. They're a fast way that guinea pigs can have consumption of food. So they can, because there's less chewing involved, they can consume pellets really, really quickly. So essentially for weight gain, they're really good. You know, it can help in that way. But a more natural way of doing that would be corn husks or corn silk, or corn itself is really, really a good way also to do it. So yeah, you have to adjust things slowly and one at a time. If you adjust too many things at once, then you don't know what's working and what isn't. Unfortunately, with stones, when they do hit, they hit quickly, and then you literally have to act fast. You've got a guinea pig that might be peeing blood. You notice when they're sort of hunched, crying, there's a little droplet of blood. That could be a straightforward bladder infection, or urinary tract infection, but it could also be as a result of a stone being there. So could be masking out. If you did have that happen, let's say you've got a guinea pig that's hunching and is leaving spots of blood. The first course of action is actually antibiotics, because that's needed regardless, because if sludge is involved, you need that for the infection level, but also pain relief. So you may not be wanting to take an x-ray due to cost or due to whatever the situation may be. You may not be able to even book in straight away, but the first course of action is pain management and antibiotics immediately. And then following on from that, if it doesn't resolve, then you do need to follow up with an x-ray to confirm what's going on, and then you can make decisions based on what you can see, so that you can sort of step in that way. If guinea pigs do have stones and they block the exit point from the bladder to the urethra, that is really dangerous and it is an emergency, so you do need to act on that very, very quickly. Yeah, with a vet. But of course you can't see what's going on in there. That's the added advantages of x-rays. And I know a lot of people in different parts of the world that contact me may not have vets that are available for another week or a few days, or don't have the cost to look at the x-ray aspect. So always trial antibiotics first in the case that it might be a urinary tract infection. One of the differentiating things with a urinary tract infection and a stone can actually be your own level of care for the guinea pigs. So if you know that they've had 2 weeks of the neighbours looking after them, you've been away and the cage isn't kept as clean and it's dirty, or there's been for some reason it's manky, like the vegetables were left in there, or it's just a really manky, dirty cage, poopy cage, then it's more likely that a urinary tract infection is what's going on. But if your cage is always clean, always looked after, and they start having drops of blood, I'd be a little bit more suspicious about stone involvement in that case, because it's less likely. So hopefully that helps. Yeah. But again, the first course of action is that. So yeah, I hope that helps. Okay, I think we've covered most of that, and some of it a little bit, probably a bit too much detail maybe. I'm not sure, maybe not enough. Let me know in the comments. If you're watching this later, pop your comments down below, because I'd love to hear them, and certainly share it out. This is actually going live to quite a few different pages as well as YouTube. So hello to all the Facebook users and the group out there. We've got a big group. I hope that this is of interest to you and it has helped somewhat, because it is an area that I see all the time. So crop up. And just check your piggies one at a time. Pick them up like I did the girls that are there, and see. Now boys, actually we should touch on boys. When you pick them up, you cannot see a lump like that. You just won't see that, but you will have abdominal pain. So if there's abdominal pain there, you need to look at that aspect. So okay, everybody, thank you so much for joining me tonight. And yeah, if you are watching this live stream later, please pop your comments down below. If you are here presently, I'd appreciate you clicking on like, so that other people may find this interesting and of help to them. Okay, take care everyone. We'll be back soon. Bye for now.